Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through pain scale chart assessments. So what is a pain scale chart? A pain scale chart is used to assess and understand the severity of a patient's pain. By providing a standardized method for assessing and tracking pain levels over time, pain scale charts can help improve communication between patients and healthcare providers and ultimately improve patient outcomes. The chart typically contains a range of numbers, often from 0 to 10, with corresponding descriptions of the level of pain associated with each number. Patients are asked to identify the number that best represents their pain level. Some pain scales may include additional factors such as the location of the pain or the type of pain, for example, sharp, dull, or throbbing. There are a variety of healthcare professionals who can use the pain scale chart, however it is commonly used by nurses and doctors. Here's how to use a pain scale chart effectively. The first step is to complete the client information at the top. You'll then need to consult the chart for specific pain levels. The final step is to fill out each section to develop treatment, as well as recommendations to alleviate patient pain. To view a sample assessment of the pain scale chart, feel free to visit carepatron.com where you can access and download the chart for free. You can also access the chart through our platform, filter by community and assessment, and type in the keywords to find the note. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos in the future.